My name's Marc Brockmann. I'm the head of the Department of Neuroradiology here at the University Medical Center in Mainz, and today I would like to talk about some of our experience with the new ultra-high resolution CT Canon Aquilion Precision, which we are using now since approximately 1 year. The Aquilion Precision is a completely new developed computed tomograph. It has a new detector, new X-ray tube, and the couch has also been newly developed. The detector is a 160 row detector, and the special thing about this detector is that the detector elements with 0.5 millimeters are much smaller, as you can see here, than normal detector elements used in other CTs. The advantage is that you have the possibility to reach higher resolution images than this would be feasible with normal detector elements. So the image quality should, as you can see down here, be much better using this high resolution detector element compared to another normal resolution detector. The resolution we can reach with this detector are a maximum of 150 micrometers, which is the same as approximately 50 line pairs per centimeter. But not only the detector has been newly developed, also of course the X-ray beam or the X-ray tube has been newly developed, so that we have a much smaller focal spot size of 0.4 by 0.5 millimeters, as you can see here, which allows a sharper beam of the X-ray tube to also use the advantage of the high resolution detector. The reconstruction matrices has also been upgraded kind of, because we do not only use 512 by 512 reconstruction matrices, but the matrix for reconstruction is also can also be chosen to be 1024 by 1024, or even 2048 by 2048 reconstructions are feasible using the new Aquilion Precision scanner. For all of these reconstruction matrices, normal iterative reconstruction algorithms and model-based iterative reconstruction is available. It's called FIRST. And for the 1024 by 1004 matrix size, we have also a deep learning-based reconstruction algorithm, which is called ACE by Canon. One thing one has to remember is, of course, that data volume increases with the number with the resolution of the reconstruction matrix. So if you go from 512 to 512 to 1024 by 1024, you increase the data volume by a factor of 8. And the same happens when you do this from this step to 2048. So it might not be useful to use this ultra-high resolution reconstruction matrix for very large data sets, not yet, but this one is just fine for almost all data sets. The reconstruction, as I told you already in the image before, it's iterative reconstruction, model-based iterative reconstruction, and the deep learning-based reconstruction. And about the deep learning-based reconstruction, which is available from Canon since 2019, works as follows. First, you have a training. So you have a very low quality data, and you have a high quality data. And the network training is that the computer tries to come from here, from this low quality image to this very high quality image, and once it has established its way from coming from this low quality to this high quality image, this neural network can be transferred to your local CT scanner and can be used to reconstruct any image you want to. So here's an example of different reconstruction algorithms used. This is the 1024 reconstruction matrix, as you can see here, and we've reconstructed this CT angiography of a patient's head, first in this image using a normal filtered back projection reconstruction algorithm. You see it's a little bit noisy all around the image, especially here the vessels are also noisy. And if we use another algorithm for reconstruction. This is normal iterative reconstruction algorithm, REDR 3D. Then you can see that from here to here, image quality improves. We have less noise. And now if we use exactly the same image and reconstruct it using the deep learning based ACE reconstruction algorithm, it feels a little bit like putting on your glasses again, because the images are much sharper delineated and there is less noise compared to the older images if you come from here to here and finally to deep learning based reconstruction. So there's a real improve in image quality. I have another example of the image reconstruction using ACE. These are images, 4 scans of always the same patient. This is a patient who's frequently in because he had a carcinoma of head and neck area. So 3 scans have been made with our old Aquilion 16-row CT, and 1 scan has been reconstructed using the deep learning algorithm in combination with our ultra-high resolution CT. And as you can see, I think when you look at these 4 images, you will guess which image is the one we've scanned with our new scanner. You can see here, it's of course this image. And you can see that the delineation between, for example, muscle and fat tissue here or here in the other images, in this image with a new scanner, new reconstruction algorithm, ultra-high resolution, it's much sharper than in all the older images. And especially, as you can see here, X-ray dose is much smaller, much lower. We can also put this in numbers. The steepness of this slope here with a new scanner, which is blue, it's much steeper. So the images are much sharper, more crisp. So you really, it's much more nice to see these images. If you're getting used to watch these images and then you have to switch back to an old image, it really always feels like you are missing your glasses. So when we take a look at the signal to noise ratio here with the old scanner and here with the new scanner, you can see that the signal to noise ratio, even though we have less radiation dose, is significantly higher with the new scanner compared to the old scanner. And also the contrast to noise ratio of muscle and fat tissue is significantly higher with the new scanner compared to the old scanner, despite having lower radiation doses. The DLP here, this is not significantly different, although we are working on this. I will show you some pictures later on. Here, these are some pictures. Same patient, scanned 2 times for his carcinoma follow-up controls, and you can see one of these images has a little bit higher and one of these images has a little bit lower radiation dose. I don't know if you spot the difference of these 2 images. You can see it here. The image on the right side has a dose of a DLP of 183 and the image on the left has a DLP of 308. And this is just the beginning. So we're currently trying to reduce doses as far as we can while having a very high image quality. So, but in neuroradiology, of course, we're not only scanning CT angiographies of head and neck or brains or spines, but also the temporal bone is of high interest. The temporal bone is really of high interest because it has very tiny, small structures, like for example here the stapes, which is very small with the anterior crus, the posterior crus, and you can see this very nice here in this image at 120 milligrays per centimeter. This has been performed with the ultra-high resolution scan mode and the reconstruction matrix of 2048 because it's not a large data set, and you can very nicely see the anterior crus, the posterior crus. You can even see that there's a little anatomical variance here and the posterior cruce, and you can even see the little tendon between the promontorium and the head of the stapes, which is exactly here. This is just another cut, and you can see here that the anterior and the posterior cruce are depicted, and this change in size of the posterior cruce, it's not a imaging artifact. This is really in this patient, as you can see here. CT angiography, of course, is another very nice and important thing when you come to high resolution or ultra high resolution scanning. You can see the brain vessels in CT angiography far until the periphery, which is very nice, and you can of course detect very small vessel occlusions in the of the MCA, for example, far away in the periphery, which increases diagnostic accuracy. Using the deep learning reconstruction algorithm, you can see here for this image, for example, that the neck vessels are depicted very sharply, and this is of course extremely helpful and extremely nice if you want to analyze some of these images. Here's a comparison of conventional catheter angiography of a patient. This patient had a little fenestration here in the proximal A2 segment. As you can see here, this is 3D digital subtraction angiography, a 4-second scan with a cone beam CT or flat panel detector, and this is also the 3D rotation angiography scan, and you can see the defenestration here. And this is a scan with our ultra high resolution scanner reconstructed with deep learning algorithm, and you can see also this very small fenestration here on the left side, which is from the image quality not the same, but already quite good, one has to say. For aneurysms, for example, it works just the same. Again, here ultra high resolution 1024 matrix, and this is the Aquilion Precision data set, and this is the 3D rotational DSA data set, and you can see that image quality of the CT when it comes to these small details is very nice. Despite ultra high resolution, of course, other facts work very nice in this neuroradiological setting. For example, the subtraction scan, or Shore subtraction, how it is called by Canon, works very nice. You can see here, this is a CTA with 2 scans, one pre-contrast, one post-contrast, and it has been stretched and morphed so that the subtraction really is done perfectly, so that you can take a look at all the vessels also in the skull base without having problems with artifacts. So to conclude, after a little bit more than 1 year using the Canon Aquilion Precision, we are really very satisfied with this device that has very nice image quality alone, and of course in combination with a deep learning algorithm for special questions like temporal bone. The ultra high resolution of 2048, the ultra high resolution reconstruction matrix, is a very nice thing, and we can also start to reduce doses, and we're still working on that, especially due to the deep learning aided reconstruction algorithm. All this together leads to increased diagnostic confidence, and yes, this is something that we really like to have in our department. So here's a final image of the Aquilion Precision, which we're using in our department. We hope that this little talk was of interest to you, and if you have any questions, you can always write me an email, of course, or give me a phone call. Thank you.